Hi, my name is Allie Badalamenti, and I'm a current genetic counseling assistant with the UT Southwestern Medical Center in their Cancer Genetics Department. The purpose of this presentation is to provide you with a broad overview of cancer genetics and genetic counseling for hereditary cancer. Before we discuss cancer genetics, it's important to have an understanding of genetic counseling in a broader sense. The National Society of Genetic Counselors, or NSGC, defines genetic counseling as a process used to evaluate and understand a family's risk of an inherited medical condition. A genetic counselor is a healthcare professional with specialized training in medical genetics and counseling. As of 2020, the largest primary specialty areas for genetic counselors are cancer and prenatal genetics, but genetic counselors work in a variety of areas, including pediatric genetics, neurogenetics, metabolic disease, general genetics, genetic testing, adult genetics, and cardiology. Additionally, genetic counselors work in a variety of settings, including universities, hospitals, laboratories, nonprofits, and government. As genetic counselors specializing in cancer genetics, our job is to help patients understand the role genetics plays in their cancer diagnosis or their risks to develop cancer. It is helpful to remember that while all cancer is genetic, not all cancer is hereditary. You may be wondering, what is hereditary cancer? Cancer itself is not hereditary. Families do not directly pass on cancer to future generations. Hereditary cancer refers to an increased risk for cancer due to a gene mutation, which can be inherited and passed down in families. In general, most cancers are sporadic, meaning they are not caused by a cancer predisposition syndrome. These cancers are caused by a combination of genetics and the environment. Certain risk factors can increase an individual's risk for developing cancer during their lifetime, including age, lifestyle, and environment. The cause of most cancers is unknown. About 5 to 10% of cancers are considered hereditary and caused by a genetic predisposition to cancer. Here, we see a diagram of someone's family tree and medical history called a pedigree. The arrow indicates the patient, or proband. Circles represent females, and squares represent males. A slash through a circle or square indicates that the individual is deceased. The different colors indicate different cancer types as outlined in the legend. When taking a patient's family history, there are certain red flags that may indicate the presence of a hereditary cancer predisposition syndrome in the family. These different red flags are outlined in the pedigree for the example female breast cancer patient shown here. We see a history of cancer in multiple close relatives, including the same type of cancer in multiple family members, as well as groups of tumors that are consistent with certain hereditary cancer predisposition syndromes, such as breast and ovarian. We also see cancers diagnosed under age 50, which is considered an early age of onset for many cancers. Additionally, cancers are present in multiple generations, and we see an individual with multiple cancers, 2 separate cancers in this example, but this could also indicate separate primary cancer in the same organ or bilateral cancers in paired organs, such as cancer in both breasts. Lastly, we see cancers that are considered rare and may have a stronger hereditary basis, such as ovarian cancer. The genetic counseling process to evaluate an individual's risk for hereditary cancer begins with a referral to a genetic counselor. Patients with a personal history of cancer are often referred by providers on their oncology care team. Some patients may also be referred by their primary care physicians or other care providers, or self-referred. The patient then meets with a genetic counselor to review their personal and family history of cancer, which the genetic counselor uses to evaluate their risks to have a hereditary cancer predisposition. The genetic counselor then identifies genetic testing options and educates the patient on these options to help them decide which is best for them. If the patient elects genetic testing, a blood or saliva sample will be collected and sent to the test laboratory. When the genetic testing is completed, The genetic counselor reviews the results and makes recommendations regarding cancer screening and management. Genetic testing for hereditary cancer involves analyzing genes that are involved in preventing cancer development in the body. When an individual has a mutation or harmful change in one of these genes, that causes the gene to not function properly. This means they do not have the same degree of protection against cancer as others do, and therefore have increased risks to develop certain cancers. There are 3 possible results with genetic testing: positive, negative, and uncertain. A positive result means a gene mutation was identified that increases an individual's cancer risks. A genetic counselor presents a patient with options to help manage their cancer risks, which may result in a change in medical management, including additional cancer screenings and risk-reducing surgeries. For individuals that already have been diagnosed with cancer, a positive result may also provide additional treatment options. Family members may also be at risk to have inherited the same gene mutation, and genetic testing would be recommended to help relatives better understand their cancer risks and options to manage these risks. A negative or normal result means that no gene mutation was found, and there are other possible causes to explain a cancer history. Increased risk management may still be recommended for patients based on their personal and family history. Lastly, a variant of uncertain significance, or uncertain result, means a genetic change was identified, but we do not know if this change leads to an increased risk for cancer. Genetic counselors do not recommend changes in medical management based on an uncertain result, but may recommend changes in management based on a patient's personal and family history. An uncertain result may be reclassified to either a positive or negative result in the future. There are different types of genetic tests, and the appropriateness of each test is assessed by the genetic counselor for each patient. A multi-gene panel analyzes multiple genes at one time. These panels can be comprehensive or focus on a more specific cancer type, like a breast cancer panel or colon cancer panel. The ability to test multiple genes at once makes these panels more cost-effective and efficient. Still, these panels present the possibility of an unexpected result, especially in high-risk genes with aggressive management recommendations. They also present the possibility of identifying a mutation in a gene with limited information about cancer risks, meaning we do not have medical management recommendations, and it may not be helpful in making treatment decisions. With these panels, a patient is more likely to get an uncertain result. A more targeted genetic testing option is a single gene or limited gene panel, chosen for a patient with concerns for a specific gene or genes based on their personal and family medical history. Most genes tested using this method have well-known cancer risks and established treatment guidelines. This allows for more focused and tailored counseling and testing. These tests are less comprehensive, and ultimately, the patient may request follow-up testing of more genes. Ordering additional testing can be time-consuming and may end up costing more than multi-gene panel testing. The most specific type of genetic test is a single-site analysis, which is only appropriate if there is a known gene mutation in the family. If the familial mutation is known to be the cause of cancer in the family, this approach can give the most precise risk estimates. This testing also provides the most definitive form of result, a positive result, or a true negative result. To order a single-site test, the familial mutation must be known, meaning reports for other family members are required. Additionally, a single-site test may not provide complete cancer risk information if there are other unrelated cancers in the family. The mutation is not known to be tracking with cancers, or there is a family history of cancer on the other side of the family. There are numerous benefits to genetic testing. It can help to identify personal cancer risks and the appropriate management, including increased screening and other risk-reducing options. It can also impact a patient's current cancer treatment. Additionally, it can provide cancer risk information for a patient's family members, allowing for more targeted testing for relatives. Genetic testing can help provide an explanation for a personal or family history of cancer. Still, it is important to consider the limitations of genetic testing as well. While the scope of knowledge in the field of genetics continues to expand, we know that not all genetic mutations are identifiable through genetic testing. Additionally, uncertain results may not help to provide the answers that a patient is looking for and will not impact their care management in any way. Negative results may not fully clarify an individual's cancer risks. A positive result can only help to provide a probability, not a certainty, of developing cancer. In some instances, we have limited information and no current established management recommendations for some genes. Other points to consider when thinking about pursuing genetic testing is the possibility of receiving unexpected results, as well as the accompanying psychosocial concerns, including anxiety and guilt. Individuals also face the possibility of genetic discrimination. GINA, or the Genetic Information Non-Discrimination Act, prohibits discrimination on the basis of genetic information with respect to health insurance and employment. This prevents health insurance companies from denying coverage or adjusting premiums based on an individual's predisposition to a genetic condition, and also prohibits employers from discriminating on the basis of predictive genetic information. GINA does not include protections from genetic discrimination in life, disability, or long-term care insurance. A genetic counselor will discuss the benefits and limitations of genetic testing with a patient to help them determine if genetic testing is right for them. Additional information about genetic counseling, genetic testing, and hereditary cancer genetics can be found through the National Society of Genetic Counselors and the UT Southwestern Cancer Genetics Program.